I'm Bob Wace, Director of Government Community Relations for the UC Davis Health System and a professor at the med school at UC Davis. I'm a bit player in a much more important experience that you'll have with two nationally renowned scientists. Tony Eiten from the California Endowment this morning referred to something that's a buzz phrase, but more than that for a lot of us involved in climate, the ecology, healthcare, and medicine. He talked about upstream healthcare and upstream medicine, which is a nice way of collapsing our less elegant trade reference to the social and environmental determinants of healthcare. Upstream, if you like, is a metaphor that we've put together over the last couple of years. Think of Niagara Falls. And if you've ever visited Niagara Falls, what a wonderful, powerful experience that is. And if you ride in the Maid of the Mist down there and are all captured and don't capsize, and it's a terrific experience. For the healthcare and environmental and medical care community, what we mean by upstream is that over time we realized that decades and decades of teaching the medical model has led to a certain kind of trained dysfunctionality. We're very good at training doctors, nurses, and allied health professionals and treating patients and symptoms, of locating clinics and communities and hospitals and building medical schools. We're very, very good at all that, but that model will never work because that model is a model where as patients somehow get trapped in the river and then cascade over Niagara Falls, then we're the clinic in the Maid of the Mist, and we pick them up and we say, oh, this one has asthma, and we give them an inhaler so that 1 out of 20 students in the Sacramento region go to school, K-12, with inhalers in their hand. And we can treat patient by patient, and we can train really good medical professionals. But as Tony said, that's a time-worn medical model. What we need is a climate model, an environmental model, a model that addresses the ecology. We need to go upstream and to prevent people from being caught in the river and going over the falls in the first place. And that's very much. And we have two experts today that have studied the larger climate and the ecology and how those interventions can be studied and performed. First, Bill Sullivan is a professor at the University of Illinois and the director of the health and the sustainability and health lab there. He has some of the highest ratings of any professor at the University of Illinois, and is lucky enough to, after this world-class PhD training at the University of Michigan, has come home to steward and give back to the university where he earned his BA and MS. So that's a tremendous compliment both to him and to the campus, and it's always wonderful as a teaching professional to see someone who journeys back and does that. And we have Linda Rudolph, who is the co-director of Climate Change and the Public Health Project, the principal investigator in the Health for All policies at the Public Health Institute. And Linda has a master's in public health from the University of California at Berkeley and an MD from the University of California at San Francisco. So two world-class experts to help us address the whole notion of intervening upstream. Why would the Tree Foundation, of which I'm a board member, bring experts like this together for you to listen? And that's because we have a belief that having built 1 million trees in the region, 5 million would be better. The trees are beautiful, but trees are also tools. And these are some of the best experts in the country at how to use those tools efficiently. Let's turn it over first to Bill. Thank you very much.
Wasn't that impressive this morning? That was probably the best conference session 2 hours I've ever attended in my life. I don't know about you, but my congressman doesn't just kind of show up and give a brilliant impromptu description of the importance of the kind of work that we're doing. And Cindy, you did such a beautiful job of describing not only the intellectual issues that you're dealing with, but also the social issues, and I respect that. And I made a diagram, a Venn diagram about the notes that you made, so I can steal that and use that sometime in one of my talks. Good morning. I want to start off with some gratitude first for the USDA Forest Service, because the Forest Service has supported my work since 1992, and I'm so indebted to that support and the continued work that we've been able to do together. I'm also grateful to the National Science Foundation, which is supporting my work along with USDA at the current time. Let me give you the take-home message from my talk in case I put you to sleep. Here it is in a nutshell. This is it. Everyday exposure to trees enhances health through various pathways across the lifespan. That's it. That's my whole talk. And in fact, if you couple my talk with what Jeffrey and Mary and Tony said this morning, you pretty much got it. I'll give you a little bit more detail. In fact, I'm going to give you more detail in two areas. I'm going to talk a little bit I'm going to follow up on some of Tony's work on stress. And in doing so, I'm going to answer Sandra's question about the dose, about what's the dose. Or at least I'm going to give the first answer to that question, because as Jeffrey will tell you, we're going to need many, many, many answers to that question. And I'm also going to talk about attention, because attention is one of the most important resources that we have, and I'm hoping that by the end of my talk, I won't have exhausted yours. So, stress. Whoa, life can be stressful sometimes, can't it? I mean, sometimes just getting to work can be stressful. It's been reported that being a parent can sometimes be stressful. Being a professional can be stressful. I saw there's a number of students here. They might testify to the fact that being a student can be stressful at times. Our bodies have an incredible capacity to deal with stress. When we're faced with a traffic jam, or an unreasonable child, or an unreasonable boss, or even a spider, our body reacts in a really amazing fashion. And Tony talked about that and I've stolen the slide from him, in fact, to talk about that in just a second. What happens is that our body responds by releasing a flood of hormones into our blood system. And those hormones, they quicken our breath, they pour insulin or sugars into our bloodstream, they provide us quicker responses, they shut down our digestive system, they enhance our immune system. If you work for a nonprofit organization, they prepare you to fight. If you're an academic like me, they prepare you to flee. They're wonderful. They're really critical in terms of our evolution and how they've supported us over time. Tony showed us this slide in which he said a stressor is sensed in our brain, and that sends a signal to our pituitary glands, and that sends a series of signals to our adrenal glands, and those adrenal glands then pump out cortisol. Cortisol is an amazing chemical that helps us respond in a really dramatic fashion to stressful events. The problem is, if you are stressed in the morning from a traffic jam, stressed all day long because of that unreasonable boss, go home to a stressful situation through traffic in the evening, and then are met with an unreasonable child, you may have too much cortisol in your system. And as Tony said, too much cortisol in your system messes with your capacity to have a healthy respiratory system, a healthy cardiovascular system, a healthy endocrine system, a healthy digestive system, a healthy reproductive system, and a healthy immune system. For men, it also makes you get fat. It's not fair, is it? If you have chronic stress, you are at risk for getting sick more often, for staying sick longer, and for dying sooner than your colleague who doesn't have as much stress as you do. Okay, Sullivan, what the heck do trees have to do with this? Well, as Jeffrey suggested there's a variety of research out there that looks at the relationship between exposure to trees and stressful reactions. Let's look at some of the evidence, and I'm going to do this very quickly. First of all, we can look at work by Russ Parsons and his colleagues. Russ used to be at the University of Illinois. He did this study of traffic. Getting home in traffic can be a very stressful experience. So he did this simulation study in which he created this 25-minute video, 25-minute videos, and a couple of them were what he called nature-dominated. Jeffrey, he's a very scientist. He called them nature-dominated and artifact-dominated. We might just call them green and not-so-green ways to get home. And he found, by hooking people up to physiological measuring tools, that people that had the simulated green drive home were less stressed. And they had some tiny immunization impact. So if they saw the video first and then they had a stressor, they had a tiny immunization effect associated with the green drive home. This is my buddy Junyan Zhang from National Taiwan University. He's my collaborator on a number of pieces of work. He has this tool called the ProComp 5. It's a clinical-grade physiological measuring tool. This is one of his graduate students. She's hooked up to it here. And what they do is they create these simulations in which they put people into simulated settings where they've got pictures of places. In this case, an office that's simulated with varying levels of contact with greenness, either indoor plants or no indoor plants, and then no view, a window view to a built urban setting or a window view to a green setting. And he found that the greener the setting, the more consistent the physiological profile was of a relaxed person. This is a study that I just love. It was published in the journal Lancet in 2008 by Mitchell and Popham. They looked at 40 million people over between 2001 to 2005, and they tracked their exposure to green spaces as a measure of how green their homes were, the landscape around their homes, and they also knew their income. 366,000 people died during the study, and they measured the likelihood of death as a function of the greenness around their home. And they found that for the people that had the highest income, knowing the density of the green space around their home told them nothing about the likelihood of dying. It was meaningless information. Nothing. But for the people in the middle income group, it was a strong negative predictor. The greener the landscape, the less likely they were to die. And for the people in the lowest income category, the effect was even more profound, more strongly negative. The greener the landscape around their home, the less likely they were to die. And then there's this really fascinating study. I was in India a couple years ago, and I was doing this work. I was getting ready to address a couple thousand people at this conference on urban development and health. And I was sitting in my hotel room, and I was surfing the net, getting ready for my talk, and across my email came this notice. Yo, Sullivan, there's a new paper that's been published on trees and health. And I was like, oh, what is it? And I saw this paper, and I had to laugh out loud. Urban trees and risk of poor birth outcomes. Give me a break. This is going too far. I mean, I really believe in this stuff, but this is going too far. And I read the paper, and my goodness, I was so impressed. And I fired off an email to this guy, Jeffrey Donovan, right away and said, I got to meet you. And this morning, for the first time, I did actually meet him. And didn't he give a wonderful talk today? It was really impressive. Okay, so there's pretty good information out there that this is not as healthy as this. We know that, right? We're in this room because not only do we know it intellectually, but we feel it in our bones. Here's the question. The question is what Sandra asked earlier today. What's the dose? How much do we need? We're pretty sure that this is not the relationship between exposure to nature and healthy recovery from stress or other things. We're pretty sure it's not a flat line. Is it this? We do not know. Maybe it's this. I kind of think it's this. I kind of think it's the second one. So this is my former PhD student, Bin Jiang. He finished his doctoral dissertation, and he's now Dr. Jiang as of last month. For his dissertation, this was funded by the USDA Forest Service, by the way. We looked at 4 cities in the Midwest. And they all had we looked at a bunch of blocks. We looked at 253 blocks that we actually went to and took photographs of. All the blocks had incomes of $50,000 to $75,000 census tract blocks. We identified 50 of them that we were going to use for this study. And for each block, we measured the density of the tree canopy within that single block using photos from Google Earth and also from panoramic videos that we took on the scene. So you can get a sense of the different levels of green cover associated with these blocks, right? So here's what we did. We created 3-dimensional videos. We used a 3D camera mounted on a tripod, and it used a standard protocol, and we took sweeps of the block that took about between 25 and 30 seconds. We did, for each one, we took 5 different shots, and we selected the one that was the smoothest and had less sun variation across it. And then we combined these shots into 10 different videos, and the videos lasted 6 minutes each. So any video would show you 5 different scenes of street landscapes that had the same density of tree cover, 2%, 4%, 15%, 20%. Does that make sense? Okay, then we invited people to come into the lab. We had 160 people come into the lab. They were all adults, about half male and female, and we hooked them up to this ProComp Infinity 5-channel physiological grade, clinical grade tool that measures physiological reactions. Here's a picture of one of our graduate students hooked up. We also took cortisol from people. We actually used Salivettes, and we asked them to chew on these Salivettes, and we collected salivary cortisol. And we also asked them to fill out a short questionnaire in which we asked them how anxious they were feeling in the moment. So we hooked them up to this stuff, and then the first thing that we did after we hooked them up is we gave them some stressful experiences. We asked them to give a 5-minute impromptu speech on their dream job in front of 2 people dressed in lab coats and a video camera. For some people, that was a very stressful experience. But just in case that wasn't stressful enough, then we really brought out the big guns. We said, now we'd like you to do a subtraction test. Please subtract 16 from the following 4-digit numbers. Please subtract 16 from 1,291. And we would wait, and they had to do it all in their head. No paper and pencil. This is awful. It was miserable. It was stressful. And it lasted for 5 full minutes. So after we got everybody stressed, we then randomly assigned them to watch one of those 6-minute-long videos, one of the 10 videos. And they used one of this fancy tool. It's designed for gamers. It's designed by Sony. It's a 3D experience. You see the videos in 3 dimensions. And we took continuous measurements of their skin conductance, and we got their cortisol measures again. And they filled out the questionnaire before and after. So, the first question is, did the speech and the subtraction test actually produce stress? Well, I'm going to show you the baseline measure of cortisol. The cortisol measure was a little more than 0.15 when they were sitting before they did the stressful test, and then afterwards it was 35% higher, so a significant increase. For skin conductance, which is it's one of the gold standard measures of stress. It's been reported in over 10,000 studies as a measure of stress. It went from a measure of a little more than 40 up 122% increase. So people were stressed from this experience. Then they were randomly assigned to watch these videos, and then let me show you some examples from the videos. There's one, and here's another. You'll notice that they vary by the density of the tree cover. Now, at this point, you might be saying, okay, wait a minute, let me get this straight. You stress people out, and then you showed them a little 6-minute video of street trees. And the only thing in the video that varied was the density of the street trees, and you think that's going to have an impact on the experience of stress or the recovery of stress? And you used our tax dollars to pay for this study? Okay, remember, this is the question when we started. We didn't know what the shape of the dose-response curve was. We didn't know. We were pretty sure it's not the yellow line, but we didn't know if it would be, you need a little bit more exposure before you get an impact, or boom, you get an impact right away and then it peters out. So here's the question. What do you think the answer is? What's the answer? Make a prediction. Some of you brave souls, actually hold up your hands and show us what you think it is. Is it a U? Is it a U? Is it this? What do you think? You got it? You got it in your head? Okay, here's what we found. We found a consistent linear relationship. This surprised me to no end because I was sure it was going to be a steep increase to begin with, and then I thought it was going to level out. But that's not what we found. We found that every tree matters. We found that the work that the San Francisco Tree or the Sacramento Tree Foundation does matters every single time you save a tree and every single time you plant a tree. It matters to people's health and well-being. This is Rachel Kaplan. I did my PhD with her. Stephen Kaplan's in the background. They are the authors of Attention Restoration Theory, which is a very powerful and interesting theory. Maybe somebody will ask me a question about that afterwards. Dongying Lee is one of my current PhD students. She's picked up on this theory, Attention Restoration Theory, and she's looked at schools and the relationship between schools and the kind of view you get from a classroom in a school. We looked at classrooms that had no windows, classrooms that had windows that looked out onto built spaces, and classrooms that looked out onto windows that had green spaces. Let me show you this little, let's just show you. So we looked at 5 schools, all of them in Illinois. All of them we went to in the summertime, and we had students from those schools actually come into the school, and we randomly assigned them to a classroom. We gave them some tests of attention. We gave them some academic activities to engage in for 20 minutes or so. Then we tested their attention again, and we simply asked the question, did the window condition have an impact on the outcome of the second tests? 94 students. So here's what I'm going to show you. I'm going to show you now, on the left is going to be the end of the activities, the academic activities. On the right is going to be after a 10-minute rest in the classroom with the window view. The first thing we did, the first test was simply to test their attention by asking them to do a little test called digits forward. So the researcher would say, I'm going to say some numbers and you say them back to me in reverse order, or in the same order. So I would say 492 and you would say 492, right. So here's what happened. In the no window condition, there was no statistical difference between before the stressor or before the academic activities and after the break. And the same thing held true with the windows that had views out onto a barren space. But look at this. The kids in the green room scored significantly better, 17% higher after a 10-minute break in a classroom, randomly assigned to a classroom with a green window. Okay, then we said, okay, let's try this again. Oops, this is digits backwards. So I would say 421, and you would say 124. And we would do this again and again and again until they got 2 consecutive times wrong. Here, the kids with no windows, not statistically significantly different before and after. Same with the barren window view. Look at that. 19% improvement for the kids that were in the green view. Okay, then we did this other thing this is called the Stroop Color Word Test. It's a test of attention. You ask the kids to read the words on the page. So read these words. Okay, then you say, okay, now we're going to do something a little different. You give them a different sheet of paper. We're going to say, I ask you to read 50 words, and we want you to read the color of the ink and not the words itself. It's easy at first, but after a few of them, it gets hard. Did the window view predict the number of errors that these kids made? Well, let's look. The kids in the no window condition made about 2.5 errors. The kids in the barren window condition made just under 2 errors. The kids in the green condition made 10 times fewer errors than the kids in the no window condition. Looking into a green space has profound and important implications for the kinds of classrooms that we're having. We should not be sending kids to school in classrooms that look out in places like this. We should be paying much more attention to the ways in which we surround ourselves on a daily basis with green spaces. We need to make sure that we build cities and maintain cities and manage cities and design places that have nature at every doorstep.